Hi, I'm Nikki Beitman, and this is our Charleston 3D Innovation Center. We have numerous types of machines, and we service many areas of the hospital. We've been 3D printing for our dental service for over a year now. We've stood up an assistive technology clinic within occupational therapy to make adaptive devices for patient-specific needs. We've done many improvement projects for our facility that you may see throughout the hallways of the main hospital. But today, we're going to tell you a little bit more about one of our services we offer, anatomical modeling for pre-surgical planning and education. Basically, this means we can take patient-specific imaging from radiology, select the anatomy of interest to the treating clinician, and turn that into a 3D model that we can print off on one of our printers.
I think it provides direct contact with what they're trying to do and help patients. And they can see what they're doing better than what they can see on a CAT scan. As a physician, we might be able to see things on CAT scans easily because we've been trained to do it, but it's taken a year to get there. It's taken us many years to get there and get that training. I've had a case here actually. This was a patient with a solitary kidney. His other kidney had been taken for renal tumor. Previously, the 3D model that was printed was able to demonstrate not only a tumor, but the vessels around the tumor, the collecting system in yellow, and then the location of the tumor centrally placed. While again, I might have been able to approach this without the model, it gave not only the patient a greater sense of what we were going for and how centrally located this was and how challenging this might be, it gave me a better sense of angle of approach in going into the tumor around the kidney to preserve as much kidney function as possible, avoid major vessels that are nearby, and as well as identify and look for a feeding arterial vessel going into the tumor. With this, they can look at it, feel it, hold it, and see it. In much the same sense when we present it to patients, but show them what their kidney looks like, show them what the tumor looks like, and they get it. They absolutely get it.
So once we get the model from radiology, we make sure that we have the correct imaging and we can see what we need to see to be able to segment out the objects that we want to print. We always work with the radiology department to ensure after our segmentation process is done that what we have segmented out is the correct anatomy and it looks correct. Depending on the size and complexity of the model, they typically take between 12 and 72 hours to complete. And once the model's done printing, we will post-process it, clean it up, and then bring it to the physician.
Being able to show different slices, getting different angles, different slices, and helping us be able to approach the tumor in different ways. I think it can be used in a lot of different areas. I think I'm one of the few surgeons that are using it currently here, but I think it can be used in a lot of different other surgical fields to a greater benefit as we continue to develop this program.